What's going on, everyone? This is Vince with VShred.com, back with Dr. Zaki for part 5 of this 6-part Fix Yo Body physical therapy series. And today we are talking about knee pain. So if you are like me and your knees seem to be way older than your actual body, then today this is the video for you. I'ma keep on going up till the lights go down. All right, like I said, in today's video, we're gonna be talking about knee pain. And so if you are like me and you are dealing with knee pain pretty much whenever you do something wrong to your knee, or you play a little too much basketball, or you squat slightly wrong, or you just do something to tweak your knee that your body's just not used to. Today, we have doctorate in physical therapy, Dr. Zaki here to show us how to assess knee pain correctly, and also a couple of exercises that you can do from home to hopefully help ease that pain and get you back to feeling normal again. So welcome.
Thank you for having me. Thank you to the VShred community for having me back again. So when we're talking about knee pain, we're talking about issues that people have not only in the gym, but also day to day. And most people that do work out, they generally have knee pain more toward the front side of their knee with squatting, with climbing stairs, maybe after a heavy leg day. But there are ways to get better. A lot of people, as soon as they feel their knees start feeling painful, or they want to do either complete rest, or they think, I need to go get an X-ray, I need to go get an MRI.
Yep.
But like with other videos that we've talked about, if it's a movement related issue, a lot of times movement can be the answer, as long as you know how to assess yourself.
Right kind of movement.
Yeah, assess yourself and then prescribe yourself some decent movement that can help you get back on track and feeling better.
So that's what we're gonna do today. So first off, before I get into that, by the way, if you guys wanna check out any of Zaki's work or want to check out his clinic, I'll put all his information down in the description below, or you can check him out on Instagram. It's optimized PTP on Instagram. Send him a DM if you want some help with anything, or if you want help with getting in shape. Just like with physical therapy, you need personalized help to fix whatever problems or pain you have. It's the same thing with getting in shape. You need personalized advice for whatever your specific goal is. My goal might be different than Zaki's goal when it comes to getting in shape. And so you have to make sure that your macros are on point, the type of training you're doing, the type of cardio you're doing, everything is right for your goal. So if you want help with getting in shape, we do have a free body type quiz. I'll put a link to it down in the description below. Check that out. But let's get into this video and talk about some knee pain.
Right. So like we've talked about, knee pain that most people are going to be dealing with that are active adults, that are people that are in the gym, running, whatever it is generally going to be in the front of the pain. Now, the term... Front of the knee, sorry, yeah. So the big thing that you'll see is they call it patellofemoral pain, because everyone's gonna be on Google, they're gonna be checking.
The patella?
Patella is your kneecap, so it's right in the front. So patellofemoral just means the relationship your patella has with the femur. So patella, femoral, and that's that joint that it kind of makes by gliding on top of the femur as you straighten and bend your knee. Right? So most pain that people are going to have after they work out, are they going to be around that area or even a little bit underneath?
Personally, I have most of it right there.
Right. So it's pretty common in lifters, in people that play jumping sports, people that run, pretty common occurrence, but something that can get better if you know what you're looking for. So the first thing with the knee, that as soon as people start feeling this, they'll start wanting to stretch the quad. Right? They'll want to start stretching the quad, kind of bending the knee back in this direction. Now, most of the time you have this issue, it's not bending the knee that most people have a trouble with, it's actually straightening the knee, right? So you can check that on yourself pretty easily by just straightening your knee up on one side, on the painful side, and see, can I get it as straight as my non-painful side?
Actually, this is my painful side.
So we'll check the other way. So now checking it sitting over the edge of the table is a great way to do it, to check your quad control, but you also want to see, hey, what's my knee flexibility looking like? So to check that, all you do is you sit on the table with your legs straight ahead this way. So you're going to kind of sit long sitting in this position. And easy way you can do this, I'm going to do it for Vince. A way you guys can do it at home is if you throw like a foam roller underneath your foot here, you can see, does this leg get us straight? But what we're looking for is, do both back of the knees hit the bottom of the table about the same? And Vince's do, which is great. Now we want to check, do they hyperextend as much as the other side? As soon as we hear the word hyperextension, we're thinking, oh, dangerous, I'm going to hurt myself. Not true. It's a range of motion that almost everybody should have a little bit of. What we want is symmetry side to side. We want the same amount of hyperextension here as we have here, right? So the way we check it kind of in the clinic, we'll hold the back of the knee down from the front here, and we'll just pick this foot up and see how high off the table can this foot get. And that tells us. And then when we look at the other side, we'll do the same thing. And Vince actually has quite a bit more on his painful side.
Been working on that.
Right, so because he's been working on it. So he has quite a bit more on this side. Maybe this side needs a little bit of love too. But easy way, we can kind of check that stuff out. So it's a really easy assessment you can do to see, do my knees have the mobility they need to be able to do the things day to day and in the gym?
And if they do, so let's say someone out there, you check this, you see that one knee is lacking that extension that you need, what's the next step?
Okay, so we just do what we call a knee extension mobilization. It's a really easy way to get that knee moving in that direction, but putting yourself in control so you're not just sitting there cranking as hard as you can in that direction. So all we need for this is a foam roller, so I'm gonna grab. And the knee we're working on, since better for the camera, we'll work on this right side. We're just gonna take the foot and we're gonna pop it right on top of that foam roller, okay? Now, the reason we have it here and not on the heel is because if we put it on the heel, his foot starts pushing up towards him, his knee's gonna have a harder time moving. But if that foot's nice and relaxed and the calf is nice and relaxed, now the knee has an easier time moving. So he's gonna take both of his hands, kind of put him in a cup position here, and then he's gonna go around his knee, and he's gonna push downwards towards the table. And what we should feel is a stretching towards the back of the knee here. Okay, and you can, like I said, you're in control of how much force you're putting. We want a good stretch. We don't want to over crank it like that to where we're feeling a lot of pain or discomfort. We just want to kind of ease into that, kind of push in for 2 seconds, then ease off. Then we push in for 2 seconds and kind of ease off. And generally, we're going to be doing about 10 to 15 reps here. And then almost immediately after, checking how our knee feels with walking, with stairs, or things you were having trouble with beforehand. And you can also recheck, is your knee getting a little bit straighter?
So that alone should help ease some of the knee pain.
Yes, absolutely. So like I said, when the knee extension isn't there or the other side is a little bit less, what happens is the quad and the relationship between the femur and the patella isn't at its optimal place. So we want to make sure that you have full motion because it allows you to have better quad activation when you have full knee extension, and 2, allows that patella to move a little bit better, because the only time the patella is going to have full movement here is when your knee's in extension. As soon as the knee bends, now the patella is kind of locked, it doesn't move as well. We let the knee extension, now it's floppy patella, and then we should be able to move it side to side here.
Oh, floppy patella.
Yeah.
And then as you're doing that extension, I know in our personal sessions, you've had me flex my quad. Is that something you would recommend, or is that specific to me?
No, so that's something that we definitely recommend as you progress. So now that you've gotten that motion back, now I have the flexibility back, what we want is as he's pushing down the knee, we actually want him to flex that quad, so now he builds control over the motion he has. Your motion that you have is only as good as your control over it, right? I can be the most bendy person in the world, but if I don't have control over my shoulders, over other places, then the movements I get into may not feel as safe for my body.
Cool. So first exercise is get something. It doesn't have to be a foam roller. It can be anything that you put your leg under. Get your leg into a straight position and relaxed position. Take your hands, cup them, press down, not too hard. And then the progression after that, like he said, is to press down while flexing, activating this, contracting your quad while you press down. So that's the first exercise. Now what's next?
Okay, so the second one here is if you start feeling knee achiness or pain in the knee when you're getting down into like a lunge position or deeper into a squat position, generally we want to make sure that we have muscles that are in the inside of the knee open and ability to kind of move throughout a full range of motion. So people don't realize this, but during a squat or during a lunge, during the bottom, one of the main muscles that's going to help you get up from that bottom position is actually your groin muscle. A lot of people think squatting is very hamstring, like you're working your hamstrings a lot. Hamstrings are not too active during a squat or during a lunge. It's actually going to be more our adductor muscles, which is our groin muscle. So I'll show you on Vince if you sit back up in that same position. The adductor muscles, people think groin muscles kind of only end here. The adductor magnus, which is the bigger groin muscle, actually ends towards the inside part of the knee. So it attaches right on the inside here. So it has a really good leverage on the knee and the hip to be able to do those movements that provide you high forces down on the bottom of that lunge, pushing you up out of that lunge or out of that squat. There's a reason why when we look at sprinters, they're always getting groin pulls, because it's a muscle that is used to do hip extension and push you out of that position with high forces.
So when that happens, do they feel the pain in here?
Sometimes they'll feel the pain in here. Sometimes they'll have like a difficulty of getting out of that lunge position. But most of the time, they'll either have the pain kind of on the inside part of the knee, or they'll even feel it kind of on the same spot that we were talking about in the front.
So it's back to what he said, where you feel the pain isn't always a direct representation of where the pain is stemming from.
Yes.
So the front of your kneecap could hurt, but it could be from the inside of your leg. And so trying all these exercises, that's the reason that we have multiple different exercises for you guys to try out, so that you can see what is helping you, because one exercise may do nothing while the next exercise does everything. You're like, holy crap, that just changed my life. So try all of these and let us know what you think down in the comments below.
Yeah. So for this exercise, before you do it, I do want you guys, if you're able to, try a squat, try a lunge, see what it feels like, and then do this exercise so you can retest. The reason we want you to do that retest model is because if you're just doing exercises without having some way to check if it's working,
there's no baseline.
Yeah, there's nothing we can say this is working, right? We want to make sure that you have a reason to do these exercises and they're the right ones for you. So we're gonna flip over onto our stomach, and we're gonna use the same foam roller to kind of open up some soft tissue on the front part or inside part of that knee. So he's gonna lie down on his stomach, inside part of the knee right on that foam roller, and just like when we hit the glute for the hip video, so if you haven't checked that out, you can watch that, you're gonna feel it once you're on the right spot. You're gonna hit that spot, and you're gonna kind of make a face, you're like, okay, that's the spot, right? Now, once you found that spot on the inside part of the knee, all you want is you wanna hold that there and then pick that foot up as high as you can, kind of rolling on that spot and back down. Ooh. Yeah, so you're rolling back and forth on that adductor muscle. Now, what soft tissue mobilizations do isn't fix problems that you're having. It just gives a little bit of stimulus to that muscle to allow it to work possibly a little bit better during your lunge, during your squat, so you don't have to do this exercise all the time. If you're trying to do soft tissue mobilizations to give you long-term results, you're probably trying the wrong things. You want to try active things that give you more longer-term results. Just like when you go to the gym, your spotter can't lift all the weight for you. You want to be able to do that work yourself so your body makes those changes. So the foam roller is kind of helping us out a little bit so we can move better, and so our lunge and our squat are in a little bit better position to allow that muscle to work a little bit better.
Do you recommend working up and down the leg?
Yeah. Usually you don't have to go all the way up into the groin, but I'll say halfway up the thigh is a good place to kind of stop. Just up and down. You're probably gonna hit on each spot like 5 to 10 up and downs with your foot. And same thing with a couple of the exercises we've done in the past. You should notice a pretty immediate change in your lunge or in your squat in terms of how strong it feels coming out of the bottom, or even some of the pain that you're feeling in the knee with it.
So how many?
So 5 to 10 on each spot. Find 2 or 3 spots and do 1 to 2 sets of it. That's all you kind of need for this one.
And like a minute rest in between?
Yeah, I would say, yeah, take a 15, 30-second breather in between, and then just get right back to it.
And then after, you know it's working based on
what the squat feels like or what the lunge feels like right afterwards. And and feel free to do that on both sides. You can open up both sides and do it, and you should feel a much freer movement. But like I said, the thing that's gonna make you have a long-term results with this is actually the fact that your squat feels better and you're more comfortable doing that motion more repetitively.
And I highly recommend trying this one out. I see Zaki, I should probably see him more, but yeah. I see him once every other week or once every 3 weeks, once a month, something like that. And this is definitely something that has been thrown into my routine, and I have probably the worst knee issues of anybody I know, consistent knee issues, and this is one thing that has helped me tremendously. So I highly recommend at least trying it out and just seeing what it does for you.
Right. And then when as we're talking about knees, a big thing we have to understand as well is that a lot of times when you do have, same thing with the back, when you find MRIs or x-rays of your knee that show you having some kind of deterioration or some kind of issues, it's not something that signals, oh, I need to get a knee replacement or I need to get surgery. A lot of people have those issues in the knee and don't have any pain. So those things can exist without one another, which is the image having some discrepancy and then also pain. So those things aren't immediately tied into each other. So we should be able to work around it if it's a movement related issue.
So what are you recommending as the third exercise?
So the third exercise we're going to talk about is actually modifications of any exercise you're doing with your legs in the gym. Now, we've talked about in the past for squatting in that low back pain video. If you haven't watched that, check it out. What we talked about is the knees tracking over the toes and how it's not an inherently bad thing, right? So when you're squatting down, you're lunging, and the knees are tracking over the toes, it's actually a very good thing to be able to do. Now, when your knee is really irritable, but you still want to squat, a good way to take a little bit of stress off the knee is not letting it go past the toe, right? So kind of sitting back into the squat a little bit more, just to still work that squat pattern a little bit without having to take a complete break and without irritating the knee. So something like a box squat, where we put a box back there, you reach back to there, is a good way to kind of reintroduce that. Same thing can happen with a lunge, right? So if he does a lunge and he's letting that knee go past the toe, it is a way that puts a little bit extra stress on the knee, but not a bad thing unless his knee's really irritable. At that point, he can just shift the weight back a little bit and not let that knee go past the toe. The hips are gonna be taking a little more weight there, but the knee comes out usually unscathed and feeling a little bit better. So any exercise you do in the gym, whether it's a squat, a lunge, a leg press, a split squat, whatever it is, can be modified to take a little bit of stress off that
So
knee.
where would you recommend starting and progressing?
So I would recommend starting in a position where you have, so say, let's take the squat for example. So what I would recommend to start off with, is, especially if you're having some trouble with squats, is have a marker you're going down to. So if you're doing a box squat or a bench squat, what you want to do is have something solid there that you know you're reaching every single time, so you're not leaving anything up to chance. So now, as Vince squats back, he knows every time he goes back, he's reaching his butt back so the knees don't go as far forward, and he's hitting the same spot every single time, and he's coming back up. So great place to start. And eventually, just move that box a little bit lower and lower. So if you have something else in the gym that's maybe a little bit lower than that, start using that instead by a couple inches at a time.
And this could even be a little low to start. Like you could have a box that's 6 inches higher than this, and in reality, you're only going down to there.
Yeah.
And then standing back up.
Yeah.
Going down, standing back up, and getting it to where it feels good. And now, rather than going to there, you're going to there.
Right. And all these modifications we're making, remember, we're doing these with the intention of eventually getting back to the full exercise. Nothing is off the table forever. It's just little modifications as you're dealing with things that can help you still exercise, but then eventually getting back to the things you want to do.
And I think that's huge to really hear what he just said. No exercise is ever always off the table. It can be off the table temporarily while you get your body back to feeling good so that you can do that exercise again. But never really, I mean, correct me if I'm wrong, you shouldn't really ever say that you can't ever do an exercise ever again. Oh, I don't do that exercise. Well, maybe that's just a temporary thing, and you should change the way you think about that and address that problem so that you can get back to doing that exercise.
Right. And yeah, and that definitely depends on, like, if you have any serious issues going on, that can
Right.
change some stuff. But in the general population, I would agree with that statement.
All right, but there you have it, guys. 3 different exercises that you can try out if you're dealing with knee pain. I know knee pain is a super common problem amongst people. I think low back pain and knee pain are probably the 2 biggest. For me personally, and probably just the people that you see in your clinic. And so if you're out there dealing with knee pain, I highly recommend trying every single one of these exercises out and seeing just which one is the most beneficial for you. Because obviously, Dr. Zaki's not in your living room right now assessing your body. And so if you have serious issues with your knees, I mean, the thing that we recommend overall is going and getting someone to look at it and getting like professional one-on-one help rather than just a generalized video where he is trying to give you the best information that we can through a video. But get some help if it's serious. Try these exercises out. Let us know how you liked it. If you did enjoy these exercises, you like these types of videos, make sure that you are smashing that thumbs up button below and also subscribing to the channel and turning the post notifications on, because next Sunday we have the final part of this 6-part series where we're going to be talking about ankles. And I know ankles might not be a huge topic for most people, but it can be a serious problem. It was one of my biggest problems with my squat and has caused knee pain. And once you get that fixed, things get a lot better. So make sure that you're subscribing, turning on post notifications, coming back for that video. But thank you so much for being here with us today, and we will see you in the next one.